Hi everybody, this is my informative speech. For my informative speech, I chose to discuss paleopathology and its role in anthropology. My thesis is that the shift from hunter-gatherers to agricultural societies promoted new social diseases and poorer health outcomes. The pharaoh Tutankhamun is the most famous mummy ever discovered and one of the most well-preserved. He was discovered in 1922 in a coffin leafed in gold, according to an article published by the Irish Times. According to an article published by the Irish Times, paleontology studies included that at the time of his death he was suffering from malaria as well as a bone condition that was very rare, so they only would have been able to do that if they had used paleopathology to figure out why he had passed away when he did. So again, stating my thesis, the shift from hunter-gatherer to agricultural societies promoted new social diseases and poorer health outcomes as a result of decreased diversity in food resources and the building of city-states, which caused people to live closer together, which promoted, in turn, new diseases. Paleopathology is the study of social conditions of disease epidemiology. Some methods of paleopathology include skeletal paleopathology, which is the primary use of the study. Bones tend to be preserved a lot better than soft tissue, so they're able to study a lot of more different diseases with bones because they last a lot longer. You can tell a lot of infectious diseases from bones as well, including tuberculosis, syphilis, and leprosy. Bones can also tell us a lot about social conditions, diseases, nutrition, and social status. Another method of paleopathology is soft tissue paleopathology. That is mainly the study of mummies. Obviously, the most famous mummies are the ones that are preserved in Egypt, as well as Ots that was discovered in Europe, and then the Siberian mummy that was the female that had tattoos all over her. She was discovered in Siberia as well. Those are incredibly well-preserved mummies, and they provided us with a lot of really interesting details about the life that they led, how they passed away, the type of food that they ate. Another really famous study that they found was Moller Christensen's leper colony discovery in 1953 in Denmark. So this is a really interesting study because they found a mass grave for lepers. Leprosy is another condition that you can determine from bones how they passed away and the extent of the disease. So this is really interesting. It was really good for leprosy because leprosy is traditionally really pushed off and people don't really give leprosy the credit that it deserves. There's a lot of leper colonies that are largely ignored in societies and not routinely studied. So that gave them a little bit more push to be able to study leprosy a little more and really promote paleopathology as a study as well. So paleopathology can also be used to study current social conditions and disease transmission methods in modern day society. They use that all the time in epidemiology, the transmission of diseases, that being COVID-19, which I don't believe would be present in bones, but we don't actually know that. So it may be something in the future that we are studying as well with paleopathology. Paleopathology, as I said, is transmissible to modern day studies of public health and epidemiology and the spread of diseases across populations. So as stated before, the agricultural revolution promoted a lot of new social diseases, and that is still in existence today, social diseases, because we live a lot closer together than we used to, and that promotes a lot of different diseases. So the study of ancient diseases and how they spread through a population and the nutrition that was available to them at the time really helps us shape modern population health studies and give us accurate data as to how to prevent the spread of certain diseases in the future. It also gives us an idea of diseases that are now not around anymore or diseases that are still present throughout millennium. So that's a really interesting idea to think about, and then it also really helps us shape modern medicine and how to treat patients, and how to understand disease transmission on a population level.